Good morning, everybody. Thank you for being on here this morning for our Thrive Live Q&A session. Hopefully you've had a chance to review the documents that are on our website with all of the items that are needed to sign up with Thrive Workplace Solutions or benefits. We have Erica Sylvia and Caroline DeJong with us today, and they'll be talking through this exclusive GCCA member benefit. If you are not yet a member and you're here to get information, please get with me if you need help in getting registered so that you can take advantage of these benefits and help strengthen your team and your center. So thank you very much. Erica, it's all yours.
Thank you so much, Mary. Good morning, afternoon, everybody. Again, my name is Erica Sylvia, and I'm the founder and owner of Thrive Workplace Benefits. I'm joined by my team member, Caroline, who will be helping monitor the chat, by the way, for different questions as we move through kind of the slide deck and the Q&A. I am going to share my screen. I know nobody is amazed or blown away by PowerPoint presentations, so this is really just for reference. I want this to be conversational, and please know all the in-depth information. If you haven't had a time to review it, not a problem. The PDF is in the chat. You can look at it and reach out to us anytime with questions. So now let's hope the technology gods are kind. And I will share my screen with you all. And are we all able to see that?
Yes, ma'am.
Wonderful, wonderful. All right, let me move that a little center. All right. So again, we are actually women-owned and an all-female team. We're located in Southern California, but we do have the pleasure of working with national clients such as the GCCA over in Georgia. We are completely onshore. I like to bring that up because I think we all understand the frustrations and struggles of dealing with different customer service models, which have moved offshore. So do know that your team is here. We do operate in all the time zones, and we are very much into the, I think we've all heard concierge handholding, right? At no point in any of this do I want you to feel as if you're supposed to be an expert on benefits. You're experts at running your schools and your teams. So you're to rely on us, lean on us for anything along the way. Leslie's not joining us today, but she's holding down the fort in California for me at the moment. Okay, what I want to talk about is just an overview of the program itself, right? First and foremost, we did partner with the GCCA, so we do ask that you are a current member of the GCCA and in good standing, okay? And what we did here is we really looked at your demographic, your needs, your pain points, and the struggles that you've had with offering benefits in the past. Now, I want to be very, very clear. This is different than major medical. Okay, I'm sure a lot of your employees, a lot of your staff, they go to the marketplace because they are looking at major medical plans. Major medical plans are expensive. I always use myself as an example. I'm 43 years old, female, and my silver plan is $700 a month. That's just not a practical price point for many of our folks. So this program focuses on MEC and MV plans. And these are acronyms in my world, and they stand for minimum essential coverage and minimum value, which I don't really love that acronym. But what does it do? It focuses on all of the areas core to a healthcare program: your preventative and wellness, your urgent care, your primary care, specialists, and they go up in levels. So we're very respectful and mindful of the fact that everybody has different needs as well as different budgets. So as we move through this, just know there are many options, and certain ones are going to resonate differently with your people depending on price point. We do also offer dental and vision. We found the ancillary coverages. Well, again, some of our folks are going to get their coverages off of the state-run systems. They're not actually getting these ancillary coverages. So they're very, very popular actually within your demographic. So what makes this special? How did we partner with GCCA? Well, they're acting as a plan sponsor to help get around some of the other large hurdles you face outside of the price point. Participation. How many of you have tried to offer major medical only to find out you actually couldn't get enough of the employees to sign up for the carrier to do what we call binding the coverage, right? So now you've put everybody through that exercise and still no health plan can be had, okay? So with GCC acting in this role, we've gotten away of the minimum participation per site. Now, the group as a whole, there's some, but that's why it's so powerful to have so many of you as members enrolling in these plans so that even our smallest employers get a benefit, get to help their employees get access to plans. I think another big thing is sustainability. For any of you that might be currently offering major medical or have in the past, have you ever had a year where the price went down? Probably not. Every year it's what's my increase? And I know you see this in your P&C and all your liability insurances as well, but every year it's the same question, how much is my increase? At least with the MEC plans, we have been able to negotiate a 4-year rate cap. That means the plans cannot go up more than 3% in costs. Because I think sustainability and budgeting as business owners is really important to you, right? We don't want to start offering something to our employees that we can't keep in motion year after year. Okay. I'm going to pause here and there. Caroline's monitoring chat. So if anybody has anything timely they need to ask right now before they forget, please interrupt me. Okay. So again, what's the value for you as an employer? Boost recruitment and retention. I know it's competitive out there for employees in this space and in this hourly wage space. If we do have any applicable large employers, that's those of you with 50 full-time equivalent or more employees, these plans help satisfy penalty A and B. We can do a whole nother webinar for our applicable large employers because you're subject to a lot more regulation and oversight. But these plans satisfy those penalties. Okay. Again, we're not looking for you to become benefits specialists or enrollment agents. We have automated tools, virtual platforms, and onboarding to help make this an easy onboarding and easy ongoing administration. And for the employees, there's a lot of benefits. It's not just about the coverage. There's nothing scarier than the look on a 26-year-old face when they roll off their parents' insurance and find out what it really costs, right? For a lot of people, this is filling the gaps. This is their training wheels into actually paying for and understanding their own coverage. For your employees going to the marketplace and getting these free but high deductible plans, well, now they have coverage they're not even using, right? And another thing I wanted to stress is the telehealth and the behavioral health. There is free and unlimited 24/7, 365 days a year access to telehealth as well as mental health support. That was a big ask from some of other clients in the past few years, and we were able to add it this year. Okay. And again, it's 2025. Everything is mobile app friendly. Me and my boxes. Hold, please. There we go. Okay. So, Erica, hit us with what we're really worried about. What are the rates? What are the costs? Okay, you're looking at this, but let's be very, very clear. What we're looking at here are monthly rates, okay? And you'll notice something. It's all the same. These are age, gender, and zip code neutral. So no matter the age of the employee, the zip code they live in, male or female, the rate is the rate. And that consistency is very nice for explanation, for fairness, and for your budgeting, should you choose to contribute. Okay. So as you can see, they scale, right? We have the MEC Plus, the MEC Plus Advantage. These are your minimal essential coverage plans. Is that feedback from me? Oh,
I'm not
goodness.
hearing it.
Okay, good, good. Just on my side. Okay, so the MEC, the minimal essential coverage plans, again, this is your preventative and wellness, your primary care. These are great. They scale up. The next question is, well, Erica, I need more. We need a little more coverage. I need to know that there's something for the hospitals. I need to know that there's something for higher prescription tiers, right? So again, we add them in by adding indemnity coverages. I'm sure a lot of you just went, what is indemnity coverage? You know, it's your Aflacs, it's your Colonial Lives, it's the coverages that pay you when you're sick hurt, injured instead of the provider. And then we also have the MVB choice. This is the closest plan to a traditional PPO plan. This is going to be for your folks with a little more financial bandwidth, or more importantly, more medical need. Okay. Inside the flip book, all of these plans are detailed: what they cover, what they do not, allowable visits, provider networks, find a provider links. We're very, very big on transparency. So again, this is high level, but everything you're thinking, we've got it in there. And again, the dental, we have a high and a low plan. Some people just need their cleanings and their x-rays. Some people, such as myself, needed more, right? So a more robust plan with more advanced coverage. And a VSP vision. VSP is the largest vision network in the country. Okay, and these are provided to us by Emeritus. Now, I want to pause here and say every employer probably also wants to ask me, do I have to contribute? Okay. For my applicable large employers, the answer is yes, and we will do that calculation for you. For my non-large employers, the answer is no, it is voluntary. Each employer that adopts into this program is still going to get to customize within the law, right? What does that mean? Do you want immediate eligibility to participate in these plans? Do you want 30 days or 60 days? Do you want to do an employer contribution? Can you afford to? Do you need to create tiers? I know a lot of you might have a director or manager level in your organization, and then you also have your hourly staff. Well, of course, none of us would ever discriminate. It is logical and legal that different classes of employees have different employment contracts and would have maybe different benefit contribution rates, right? And we'll work with you to find out what makes sense for you. But it's important, right? Everybody's at a different place with their business and the growth of their staff. So it is not mandatory to contribute, but if you'd want to, we can look at a percentage. We can look at a flat dollar amount. We can look at tiers, okay? Very customizable to you. Again, employees can elect to have their spouses or dependents on the coverage. There's no employer contribution mandated for anyone in that space. But again, it's a great way for your families, your employees with families, to fill gaps in the coverage. We usually find that one person in the household seems to be responsible for providing the benefits to the family, right? Now, this is where it gets tricky. Erica, I've never heard of a MEC, nor have I heard of an MV. How are they different? What's a quick way for me to start wrapping my head around the coverages I would be offering to my folks? And I think using a comparing plan options grid like this helps, right? And I don't mean to pick on certain age groups, but my MEC Plus, these are my young and healthies. I was in my 20s once. I remember. You know, the occasional urgent care. I think I picked up my allergy medicine once a year. Things of that nature, right? You see how it scales up, especially those of us with children. Children seem to really like getting sick and injured, right? So we need that urgent care. We need more visits to the doctor. We need more coverage for a hospital visit. So it's really important to understand what the coverages are and what the coverages aren't. And again, lean on our team. Your employees can reach out to us. We can explain it. We can hold group meetings. Now, it's not practical for me to say we can come on site to your schools, but we do hold virtual education and enrollment meetings before school, during school, after school hours as needed, okay? So again, we'll work with your team and your schedule for the educational component. I'm gonna pause there. That was a lot. Any questions, concerns, feedback? Some of you may have explored this previously and had a good or bad experience, but open for anyone to share, ask questions.
I do have a question.
Perfect.
What number of employees is considered a small business? Because I know you said yes to the larger business having to contribute and no to the smaller. So what's the number?
So the way the federal government does this is called 50 full-time equivalents. And the quick math is 2 part-time equals 1 full-time. So if you have 52 full-time employees, you're an applicable large
Right.
employee.
Right.
But if you have 40 full-time employees, but 20 part-time. You see, the math can get a little
Right.
tricky.
Yeah. That's true.
Right?
That's
So
true. Okay. So it's a
anything
general.
under 50. Yes. And then generally speaking, to really have a group coverage, group plan, you need to have, it's supposed to be 2 or more W2
Right.
employees, right? Because I do know
Right.
we have small centers that might be home care,
Mm-hmm.
but again, by removing the participation requirements, we've made it easy for all sizes.
Mm-hmm.
I'll just speak up for a second and say thanks, Erica, for coming on today. This is a plan that I have for my staff, and we have just renewed again, and my girls love it. My staff really appreciate that we're able to provide this for them. We just we do a small percentage of the employee-only MEC piece. So it's very affordable for us, and it still is very affordable for our staff who, and many of them did not have any kind of coverage at all. So this has been really, really helpful for me for retention and really helpful for my team. So thanks, Erica.
And thank you. And I want to bring something else too that you'll notice when you go through the flip book. With the exception of the MV plan, you're going to notice that these plans don't have deductibles. They're co-pay driven. It is very confusing for employees to say, okay, I have a $3,000 deductible, and then I have a 40% coinsurance up until my $10,000 out of pocket. It starts to feel like you don't have insurance. It starts to feel like a math equation. So again, with your Max and your Mech Plus Advantage, it's very straightforward. These are co-pay driven. I go to the doctor and I pay them what? And so it's really helps simplify that. Also, by not having the deductibles, we're allowing for what is called rolling open enrollment. So right now it is open enrollment. If anybody has been listening to me and they're like, this makes a lot of sense, I think this could have meaningful traction within my employee group, fantastic. It is open enrollment, and the plan will go live for an October 1st effective date. But Mary might be thinking to herself, Erica, I love this, but it's crazy right now. It's just absolutely crazy. I just don't feel like I'm going to get to it this month. Okay, we understand. New adopting employers come in when they're ready. They have their own open enrollment. And then you're on the plan year. And then next year in 2026, everybody will align to a 10-1 plan year. We don't have to worry about, well, what about people that hit their deductible, didn't hit their deductible? We just do a hard reset. So GCCA has a pretty broad membership. It'd be pretty crazy for us to expect everybody that's interested to adopt this at the exact same time. So again, don't be discouraged if you like what you're hearing, but right now isn't the best time. We understand. The reason we are doing open enrollment now for a 10-1 is because that November, December time period, that's when the marketplace, that's when the state exchanges have their open enrollment, and your employees might get a little confused about your coverages versus the other coverages. And just a couple words on the marketplace. Given the current administration's agenda and initiatives, there are going to be significant changes to how employees qualify and enroll in marketplace plans. My understanding is they're getting rid of passive re-enrollment, so it's going to require some effort and some lift from your employees. I feel as if that's going to bring some pushback to the employers. They're going to be looking to you for guidance. They're going to be looking to you for benefits. So again, timing is everything. We'd love for you all to join us now if you're interested, but if some people need to push it off a few months, we understand. Okay. There's also no, again, without a deductible, no out-of-pocket maximum. Those ones go together. Okay, the one thing we can't solve for is there's got to be a little bit of paperwork, okay? So we tried to streamline the process as much as possible. We have an intake form. We want you to confirm contributions, eligibility, things of that nature. Caroline will work with you to get the forms completed, and then we will launch your groups individually for open enrollment as you're ready. But where do we launch? So we use a virtual platform called EASE, E-A-S-E, and the name is literal. It is a rule-based secure online platform. Each employee gets their own login. They register. On the left-hand side of the screen, they'll see the list of benefits, the benefit types, medical, dental, vision, all the information in the middle. And on the right-hand side, very important, we calibrate it to your payroll cycles. Weekly, bi-weekly, semi-monthly. So as employees are making their selection, they know exactly how much is coming out of their paycheck per pay period. No surprises. And we do offer it pre-tax by using a POP document as well. So there is some savings by doing it on the pre-tax basis. After open enrollment closes, we send you the payroll deduction report. This helps you go into, some of you might use QuickBooks or ADP or Paychex or something more local, but this will allow you to program in exactly how much comes out of each employee's paycheck to go towards benefits. And we continue to send you this report every month because we know you have a decent amount of turnover in this industry. And we also know you get busy. So by us sending you that report and you looking at your staff and going, okay, we helped you collect credits for terminated employees. We make sure everybody stays nice and compliant. We keep all the documentation on your behalf. Okay? Try to make it as easy and straightforward as possible, meaningful and affordable for your folks. Questions? Concerns?
I do have another quick question.
I love
Okay,
it.
the doctors in network.
Mhm.
Let's say I have a pre-existing something and I have to see a doctor in a
Mhm.
certain network. How does that work? Or do you
So
have a,
yes, it is a
Go ahead.
network, right? So we
Okay.
utilize the PHCS network. It is
Mhm.
one of the largest PPO networks in the country.
So it's PPO, okay.
That being said, I'm not going to make a former president's mistake by saying you will absolutely get to keep your doctor. I have a way of knowing that because I don't know who you see, right? So
Right,
just like anything, even if I was up here trying to get you all on a Blue Cross Blue Shield plan, you have to check the provider link.
right. Mhm.
I'll be honest with you, call your doctor and ask, right? We call for people all the time, but they have more accountability to you than they do to me as a
Mhm.
consultant, right?
Right.
So
Mhm.
that is important. I know some people, if they're treating certain chronic or ongoing conditions or post-surgical plans, that's a
Mhm.
really important aspect.
Right.
Decide on how to use the links,
Mhm.
the different plans. Some of them have just like a PPO versus HMO. Some of them have slightly more robust networks.
Yeah.
And I also know that GCCA, you're actually quite spread out in the state, right? Erica, is there going to be providers near me? If you struggled in the major medical space, my super rural areas, it's always going to be a struggle, but we haven't had too many issues. This is a national network. So we're in about 30 plus states at the moment in terms of clients, and it's very rarely come up.
Okay. So this is a follow-up. So I know some Kaisers can be HMO or PPO. Do you
Mhm.
have Kaiser by any chance in your network or no?
We do not. We do not.
Okay.
I always forget that because California is a Kaiser state. There's only like 5
Yes.
or 7 Kaiser states in the country.
Yeah.
So this is different than Kaiser. PHCS
Okay.
won't necessarily carry into one of the Kaiser complexes.
Okay. All right. No problem. Just curious.
Yeah.
I have a question.
What's interesting too, it made me think of, well, Erica, what happens if we roll this out now and we only have 5 employees who sign up and then 4 months later, 3 of them are like, oh, I want to sign up now. It has to be an open enrollment session unless there's a qualifying event. So let's just say you had Kaiser coverage through a spouse, through a parent, through another organization, and you lost that coverage. That's a qualifying event. You can then enroll into one of this program's plans. Because that does happen. Qualifying events, marriage, divorce, birth, adoption, loss of coverage. It gives them a second opportunity to make a choice and elect one of these plans. Same thing with spouses and dependents.
I have a question. The plans that are in this, are they different insurance plans or like what's the name of the insurance company
The provider of these plans is called Apex.
Apex, okay.
Apex is, so little look behind the curtain of medical coverages and insurances. The carriers, I also call them product manufacturers. They are the carriers. They are the United Healthcares, the Blue Cross Blue Shield, Apex. The MV plan is provided by Trace. These are essentially insurance companies and TPAs that are facilitating this. They support the network and such. Apex is one of the largest MEC carriers in the country, and Trace is one of our newest ones to be a hybrid of a product carrier as well as a TPA.
Okay. Okay, thank you.
And I have a question. In this plan, the employers would have the option to maybe just join dental and not the medical. Is that correct?
Correct. So this is a la carte. You do not have to pick a medical plan to have dental or vision. Again, different coverages are more meaningful to different people at different times.
And
I
one,
also-
oh,
I
I'm
also
sorry.
wanted to let everybody know, in that flip book that we have, there are QR codes and there are links that take you into further information about the plans, the things that are covered. So I suggest that when you look at the flip book, click on those links so it brings you into the additional documents. We also in ease, when the employees are going in to enroll, there's links in there when they look at the plan, they'll see the name of the plan and then they'll see some links below it. Again, that information's in there too if they want to review it while they're going through enrollment.
Hi, I have a question, please.
Yes.
I don't know if you mentioned it, but is there a minimum amount of people that must join in order for us to move on?
Nope, there isn't, but I'm glad you bring it up. That's very, very important. I know a lot of people have become very, very hesitant to offer benefits because of that. There are no minimum participation per employer. So if Caroline's got 20 employees, but only 2 sign up, but Linda has 30 employees and only 1 sign up, we're aggregating you all together to hit the participation requirements. So if you can help 1 employee, we're happy to help.
Thank you.
Welcome. And I should also mention too, some of you might be offering something at this time, right? There might be some people that are managing to offer the major medical, but don't have access to vision and dental. There may be folks who said, well, Erica, we have AFLAC in here, right? And they do some of the coverages for the employees, and that's fine too. I always say we play nice with others, right? We're here to help and complement what you're doing for your employees. So if you have some current relationships you don't want to give up, don't feel as if it's an all or nothing proposition.
Sylvia, there was, I'm sorry, Erica. There was a question that someone is going to open a second center soon and reach their 50 FTE level. She would like to know what she needs to do for more information on the large employer category, what she would need to do.
I'll do a quick thing on that now because I didn't mean to scare anybody. The good news is all the rules don't apply to you the second you cross that line in the sand, right? So if I have 49 employees on a Wednesday and next Wednesday I have 52, it's not right that second. It's in the next calendar year. So you would become an applicable large employer 1/1/2026. If you want to put your email address in the chat, Caroline and I will coordinate. We have some information sheets on the rules for applicable large employer. Because it's a whole new world once you hit that space.
Okay, I have another question. I may have missed this earlier. I heard you say that it would come out of their paycheck on a weekly, bi-weekly basis. How do you all receive your money?
We're actually paid by the carriers. You will never receive an invoice or a bill from Thrive Workplace Benefits. I know and respect that some brokerages do charge consultancy fees, but we're paid directly from the carrier. It's built into the pricing. There's no hidden costs. We don't charge for our time, and we also don't charge for the ease platform access. And I want to stress that employees receive their own individual link, But Linda, as the owner, would have administrative access. She would see her group as a whole. And we do offer training. I have some clients who are very, very self-service. They go in, they pull their own reports, they enter their own employees, they terminate their employees, and you're welcome to do that. And we'll train you on how. Other people, they just email us and we perform the transactions for them. But just so you know too, we actually time it to whatever payroll cycle you use. So it's customized to you.
And I can speak to that just a little bit too, Erica. I mean, in the beginning, it took me, I don't know, maybe an hour or so to figure out how to actually put it into payroll. So to make sure that the deductions were accurate. But Caroline will send or I don't think Caroline sends it, but it comes through Caroline's team, a payroll deduction report, which you can go back each month and you can cross-reference it. And I use ADP, so I can cross-reference that in my ADP and make sure that all of the employees are actually that the deductions are right for all the employees that are enrolled. And then you get a bill. I get a bill from the carrier. And we just set it up to auto debit. So sometime around the first of the month, the money comes out of your account, but then it goes through payroll as well.
Okay, thank you.
Yes, and I apologize. The one thing me and my team cannot touch is your payroll, and that's just separation of powers. You don't want us in there, but it's a question that comes up. Well, could you just go into our payroll system and do the deductions for us? It's a safeguard. We can't do that.
Let's see, let me see.
So to sum this up, right? You do not need a minimum number of employees. You just need a few full-time employees that are going to do it, but you don't have to have like 3 or 4 people that agree to do it. That's the first thing. It's basically PPO, right? The benefits are a la carte. So if I have a doctor somewhere else and I just want dental or vision, I can do that. Just that part of it, right? So that's the gist of it. Of course, they'll pull it from the payroll. I could or could not, I don't have to contribute. If an employee picks something that's like $100 a month, they could very well pay their own $100, or I could contribute $20 toward it, and then they would pay $80, right?
Correct.
Perfect. Okay.
And no incentives were given to that woman to do that for me. That was a great recap.
Thank you.
But yes, and
Thanks.
again, listen, nothing's perfect. I don't want anyone to
Exactly.
think I'm a very real person. Nothing's perfect.
Yep.
One of these days, I'll get some organization to agree to literally an association leave a major medical plan. We're just not there yet, right? We're not there as a country yet, but every year it's about making it a little bit better and taking more and more steps towards that.
Yeah.
We started off easy this year. Again, we're doing the MEC, the MV, the dental, and the vision. But hopefully with feedback from all of you, I've already had questions. Erica, well, I really need group life or voluntary life at my center. Okay, we can accommodate that, right? We can customize. If the program's well received and we get some feedback and more requests, then next year we can add things, we can make change. Every client group is a little different. So it's a collaborative relationship with the GCCA.
Yeah. Personally, I just want to say I've tried many years to give my employees, this option, but most of them are like, no, I don't want to do it. And because of the minimum number, you have to have 2 or 3 people. We've never been able to do it. So now that you brought this to our attention, I think is a great idea, especially for our pre-K teachers who really are looking for benefits. And it's hard to find and keep pre-K teachers. So having benefits, I think, is going to add to what we're doing. So thank you for this.
My pleasure. I mean, out in California, in the same payment space, employers are competing against Starbucks and In-N-Out Burger. You want to know why? Because they offer major medical and 401k.
Exactly.
I know you want early education should be thought of as a career, not just a job, right? Not just a paycheck, but something. And I always say that the difference between a job and a career is usually the infrastructure.
Yes.
Or the growth. So we want to make it real for your folks. And I just feel like a lot of changes are coming down the pipeline, and it's going to be a learning curve for everybody, the consultants, the employers, and the employees.
Right. I have a question for my older employees. Um, one of my teachers was asking, so for the MV plan, if she, God forbids, were to come down with cancer, it would not cover any type of chemo treatments, correct?
It won't cover chemo. That is one of the exclusions. And that's why I say in the flip book, very clear about what it doesn't. Some chronic conditions and treatments are covered.
Right. Okay.
Some are not. I will say, like statistically speaking, the majority of the employees are on the younger side, but for the older employees who are trying, a silver PPO for a 55, 60-year-old employee is about $1,200.
Right.
It's just
I'm on the
really-
silver and I pay almost 1,000. Well, for my husband and I, we pay $2,000 a month. Yeah, 2,000 a month with
And
Kaiser.
so one thing I learned when I started engaging with clients in Georgia, actually with the help of Sandy Bennett, is so you've got all your federal rules, and those are already so fun and ever changing. But then you have your state. And
Mhm.
every carrier, Cigna, United Healthcare, the Blues, they regulate differently per state. So let me just give you an example I bet some of you have come up across. You meet a health insurance consultant. They say, absolutely, we're gonna do a Cigna enrollment at your school. And they tell you a price. Well, that price was if you had 80% enrollment, but if you have 50% enrollment, it's the next. And the less amount of people that enroll, the more expensive the premiums for the people that did. That is a painful exercise for everybody involved. But that's how Georgia allows them to do their rate system. They can't do that in California.
Mm.
So it's very interesting how each carrier operates per state and the different challenges it presents to the employers. Because how do you tell your employees premiums are going to be $300 to $600 a month and then they come back at double?
Right.
Yeah. And sometimes we still have to do it. Again, for my applicable large employers, we're going to have a whole support session on that. And I should mention too, Mary and Sandy and Idisha were kind enough to allow us at the conference that'll be happening in September.
Yay. Hey,
Yeah.
Erica, one question though too, and you may have already covered it, but this, if somebody is a large employer, they can have this and major medical, right?
Yes, actually, really good point. How these all came about was to fill the gap because a lot of large employers in a lower pay rate industry, they have to. You legally have to offer benefits and you have to have an employer contribution at 50% of the lowest cost plan. But wait, there's more. You may have to pay more depending on the employee ages and rates. So again, we're chasing a moving target. And so these help, right? Because no deductible. Someone's now got an $8,000 deductible plan. They fill it in with this. Or again, the participation. So these were originally created to ease the pain of applicable large employers. It was just nice that we were able to open it up to smaller employers. I do have some people that I call them paired plan environments. We do have clients where we might be offering a Cigna plan alongside this menu. Again, it's what makes sense for you and your people and financial constraints. And we'll walk you through all the technicalities and the legalese and everything that comes with that. Yeah. I know it's a lot to think about. This was a lot of information, and there's so much more inside that flip book, but we really try to break it into, digestible amounts of information at a time. We have to walk before we run, so we're going to have more information sessions. We will be at conference, but if anybody is ready to get started or wants to just schedule more time for a one-on-one, maybe you had stuff going on in the background or you have a unique situation you want to discuss, just reach out to Caroline and she'll schedule time with either herself or me and we'll chat.
And feel free to reach out to me, Sandy, if you have any questions on how it works on the provider side. Us being the provider.
Thank
And if anybody is not currently a member of the GCCA, hopefully this was rather motivating.
Gotta join, gotta join.
All right. Well, I thank you so much for taking time out of your busy day in August to listen to me. But yeah, we're here to help. We're happy to help. So just let us know how we can be there for you. And hopefully I'll talk to some of you soon.
Thank you.
Thank
My
you.
pleasure.
Yeah.
Have a great
Thanks,
day.
Sarah.
Thank you all so much for your great questions and for